What do antibodies do? Why do we need them?
So antibodies are fighting different kinds of infections, such as viral infections, bacterial infections, or fungal infections. And if they are not functioning appropriately, then this leads to an increased risk for infection for the patients.
We know that multiple myeloma cells are cancerous plasma cells. And plasma cells are very important to produce antibodies. And the antibodies are very important that we exist. Without antibodies, we would die from simple infections. So we need the plasma cells to produce antibodies to survive, because the antibodies will kill the viruses and also bacteria. The paradox is that we also use antibodies to kill the multiple myeloma cells, to the plasma cells. We know that right now we are able to produce antibodies artificially, and those antibodies not binding bacteria or viruses, they bind the myeloma cell and kill the myeloma cell. So it's a very elegant way. Sometimes the patients are confused and say, wait a moment, I get treatment with an antibody, but at the same time my body is producing antibody. What is this? So don't mix it. Antibodies are proteins that target viruses, bacteria, or tumor cells and kill bacteria, viruses, or tumor cells. You produce normal antibodies in your body which help you to fight infections, but when you get daratumumab or isatuximab, those are antibodies that are artificially produced, and they target not viruses, they target the myeloma cell and kill the myeloma cell. And if you're treated with daratumumab or isatuximab, the doctor might have told you that you have a little bit of a monoclonal M spike, and the doctor might say, oh, don't worry, it's not the myeloma, it is the daratumumab. This is because in your blood we can measure the daratumumab as a very small monoclonal M spike. Sometimes difficult to really separate this monoclonal M spike or monoclonal protein from your multiple myeloma. In special tests it is possible, but the principle of an antibody is the same. We need antibodies to fight infections, and the daratumumab is helpful, or isatuximab, to fight the myeloma.